Tics belong to the most common neuropsychiatric illnesses in children and adolescents. Many reference persons, especially the parents, are very worried if their child is suspected of having a tic disorder or if such a diagnosis has been made. In this video from Good Parents, you will learn whether and to what extent these sorrows are justified and what can be done against tic disorders in children and adolescents. Hello and welcome to Good Parents. My name is Wolfgang Hirschberg. I am a specialist in child and adolescent psychiatry from Germany. During the last 20 to 30 years, I examined and treated many children and adolescents with tic disorders. So I got a lot of knowledge and experiences in this area that I would like to report to you. Similar to many other medical terms, tic disorders mean something different in the medical sense than in the colloquial area. In common usage, quirks or special characteristics of a person are sometimes referred to as tics. So one speaks of a collecting tic when the person is downright obsessed with hoarding certain objects. In the medical or psychiatric sense, which we mean in the following: repetitive involuntary movements or vocalizations are referred to as tic disorders. These movements or utterances can also be made intentionally. Therefore, the assumption is sometimes that some of the people affected produce these movements or vocalizations to make themselves important or to attract attention. But this is definitely not the case. One speaks of a tic only when a movement or utterance is not made arbitrarily. If a tic manifests itself in the form of a movement, it is called a motor tic. If a tic occurs in the form of a vocalization, it is called a vocal tic. If only one muscle group is involved in the motor or vocal tic, it is called a simple tic. If several muscle groups are involved, it is called a complex tic. Examples of simple motor tics are tics in the facial area, e.g. frowning, winking, grimacing, or jerky head movement. Examples of simple vocal tics are clearing the throat, coughing, or strong breathing sounds. Examples of complex motor tics are hopping, jumping, or the so-called copopraxia, i.e. showing of obscene gestures. Complex vocal tics manifest themselves, e.g. as screaming, whistlings, or as utterance of obscene words, the so-called coprolalia. Tics are relatively common, occurring in about 15 to 20% of all children and adolescents. Tic disorders usually begin in preschool or elementary school age. The male sex is 3 to 4 times more likely to be affected than the female. With today's knowledge, the course of a tic disorder in an individual child cannot be predicted. The tic symptoms can vary greatly over time. In the course of a tic disorder, there are phases in which the symptoms are less pronounced, followed by phases in which the symptoms are stronger or occur more frequently. The tic disorder disappears in many children even without therapy. A tic is often preceded by an urge, which means that those affected notice that a tic is imminent. The occurrence of a tic can be consciously suppressed for a short time. However, this should not lead to the conclusion that the tic is produced deliberately. This is definitely not the case. Both the anticipation and the willful suppressibility are less pronounced in children than in adults. In the context of child and adolescent psychiatric diagnostics, other psychiatric and neurological disorders that are also associated with motor abnormalities should be excluded. If a tic disorder disappears after less than a year, it is called a temporary tic disorder according to the diagnostic manual ICD-10 of the World Health Organization, and a provisional tic disorder according to the diagnostic manual DSM-5 of the American Neuropsychiatric Association. If the tic disorder lasts longer than a year, it is called chronic tic disorder. If both motor and vocal tics occur in the course, i.e. not necessarily at the same time, one speaks of Tourette's syndrome. Tic disorders, especially Tourette's syndrome, often occur together with other psychiatric disorders, especially ADHD, as well as obsessive, compulsive, emotional, and anxiety disorders. A number of factors contribute to the development of tic disorders. Because tics often affect several family members, genetic factors are assumed to play a role in the development of tic disorders. An increased occurrence of tic disorders has also been described after streptococcal infections. In addition, in the case of tic disorders, an imbalance of tensing and relaxing impulses in the area of neuromuscular stimulus transmission must be assumed, especially in the area of the dopamine receptors. This assumption is supported too by the fact that substances which promote the release of dopamine in the brain are associated with an increased risk of the development of tics. Furthermore, it is a common experience that stress can aggravate tics. Tics can on the one hand be acutely triggered by emotional activation. This applies to positive feelings, e.g. joy, as well as to negative feelings, e.g. fear. On the other hand, tics may worsen by chronic emotional stress. It is often observed that long-lasting psychic pressure leads to an aggravation of the tic symptoms. Some children with tic symptoms put themselves under great pressure with regard to their school performance. They expect performances from themselves that they cannot achieve or only with great difficulty. Because these children cannot meet their own performance demands, they constantly struggle with a feeling of dissatisfaction. It can also be observed that some children with tic symptoms are put under great pressure by reference persons, especially parents, with regard to their school performances over a longer period of time and receive little recognition with regard to their actual school performance. Tic disorders often have a stigmatizing effect on the children and adolescents affected, so that there is a risk that they become outsiders. Many children do not understand that the affected children do not intentionally produce the tics. Therefore, the affected children sometimes are laughed at or mocked, and this is often worse for them than the tics themselves. The affected children frequently don't feel much stressed by the tics and do not even notice them, at least when the tic disorder is not very pronounced. As a rule, tic disorders do not result in any serious impairment of performance or behavior for the children or adolescents concerned. However, pronounced tics can be very painful. So far, there is no therapy that can completely eliminate tic disorders. However, the frequency and intensity of the tics can be influenced by various measures. First of all, it is helpful for parents and children to be informed about the nature of the disease. Parents should understand that the tics are not caused intentionally, even if they can be suppressed. It is also important to eliminate stress factors as far as possible. This means, above all, that excessive demands of benefits that a child places on itself or that are placed on the child by reference persons are reduced to an acceptable level as far as possible. Tic disorders should be seen as a warning signal which shows the child and its environment the limits of its resilience and should be taken seriously. Experience shows that it is often very hard for the affected child to accept this and to change its behavior. If this is the case, the child needs a psychotherapy that also includes its reference persons, especially the parents. In addition, there are behavioral therapeutic approaches that can help a child to counteract the occurrence of tics. One of these approaches is based on the fact already mentioned that the occurrence of a tic can be perceived by those affected before the tic actually occurs, the so-called premonitory urge. This can be used by the affected child or adolescent to counteract the development of the tic. Of course, this is not a causal therapy. The tics are not eliminated in the long term in this way, but at least some control over the occurrence of tics can be achieved, which can help the children and adolescents affected to cope better in various social situations. As this approach requires a relatively high degree of cooperation on the part of the child or adolescent concerned, it is more suitable for children and young people from the age of 10. There are a number of drugs that can help to suppress tics. These drugs primarily target the dopamine receptors and therefore mostly belong to the group of so-called neuroleptics. However, in addition to tic-reducing effects, these drugs also show many acute and chronic side effects, so that drug therapy should be used in childhood and adolescence only if the tics are very severe or are very stressful for the person concerned. As with many other psychiatric and behavioral disorders, there are a number of alternative therapies for tic disorders. Several homeopathic remedies shall have a soothing effect on tic disorders, e.g. Bach flowers. Whether these drugs really have an effect beyond the placebo effect cannot currently be conclusively assessed. It is certain that these therapies do not harm. Whether they really help remains open to my knowledge. In my opinion, psychotherapeutic and behavioral therapy measures are clearly preferable to both psychotropic and homeopathic drugs in the treatment of tics in childhood and adolescence. Medication of any kind should only be used if psychotherapy or behavioral therapy proves to be insufficient. It is also important to include the frequent accompanying disorders, so-called comorbidities, that have already been mentioned in the treatment of the tic disorder, as these are often more stressful for the children or adolescents concerned than the tic disorder. Overall, tic disorders are primarily physical symptoms, but psychological and social aspects play a very important role in their therapy and must therefore be taken into account. That's all that I wanted to say about tic disorders for today. I hope you liked it, and above all, it was helpful for you. If so, I would be happy if you give me a like, and of course I would be glad if you watch the next video of Good Parents, which will appear soon. For today I say goodbye and all the best. Bye bye.